Welcome back to HIP, Health Insurance Personalized. This is Consumer's Doctor. Today's topic is how do you finance your health insurance? Health insurance, folks. Let's talk about financing health insurance. Obviously, there are several options. When it comes to health care and health insurance, it's simple, folks. Health care, when you receive the care from the providers, from the doctors, hospitals, that is a health care segment. Whereas health insurance, how do you pay for it? How do you finance? How do you pay for your care? That is the financing part of the healthcare. That's where the insurance comes in, folks. Insurance is very important. I believe that, most of us will need health insurance. So let's talk about how do you finance it. The health insurance can be financed at least by three different mechanisms. One is health insurance premiums. You pay monthly premiums. And number two, through health savings, so-called savings, taxable or non-taxable, like health savings accounts or health reimbursement accounts. And what is the third option? Is incentives and rewards. A lot of people may not know there are incentives and rewards to finance your health insurance. Let's go into a little more detail. Personalized health insurance. This is what we've been talking about, health insurance personalized. When you talk about health insurance personalized, it recognizes that healthcare can be financed through at least three different mechanisms, as I mentioned. Let's talk about insurance premiums. Insurance premiums. The Obamacare mainly focused on premiums to finance health. Premiums only, they focus only on the premiums to how to finance the health insurance. Personalized health insurance recognize that if it's unleashed from Obamacare restrictions, the private market will develop products. I'm talking about a public-private partnership, folks. I'm not totally saying private market. I'm talking public-private partnerships. Will develop products and services with premiums, savings, and incentives. These innovations would provide consumers with lower cost financing options that meet the consumer's needs. Personalized health insurance expands the ability for insurers to offer multiple plan designs that provide financial incentives to its members who are compliant with health initiatives. Federal law should be changed to allow tax-advantaged health savings accounts on any plan design, folks, on any plan design. Such account-based plans put controls in the hands of consumers. This is so important. It puts in the hands of the consumers. Account-based plans, so-called health savings account-based plans, support financial rewards and incentives for a specific healthy behavioral changes, folks. For a specific healthy behavioral changes, it focuses on the consumer, and consumer wants to be proactive. to keep his premiums lower. Obviously, people want to save money, and they, by giving the incentives and rewards, they can lower their premiums. Consumers are willing to make good health and healthcare choices, should be able to share in the savings which are generated in the savings. They should earn rewards and incentives in their individual and small group plans that can be used to offset any deductibles or co-insurance. Instead of having co-insurance or deductibles, you can use your health savings accounts to pay for it. And you will also have incentives and rewards incorporated in that system. So-called these outdated state rebate laws prevent insurers like insurance companies from providing the incentives to the small employer folks. And they also prevent incentives to a fully insured groups that are allowed in the large employer self-group plans. In the larger employer group plans, most of them are self-insured by the employer. So they have, whereas the small group plans, they don't have that advantage. So there is a big difference in the smaller employer group and the larger. Larger employer groups are self-funded by the employer, whereas smaller employer groups are not. They depend mostly on the insurance companies, smaller employer groups. So the smaller employer groups could be grouped together to form a large group so they can get the same benefits as the large employer group. These incentives and rewards have proven to lower the costs and improve health and reduce unneeded use of medical care and improve quality. And incentives can be offered for wellness, condition management, disease management, and health improvement programs. The incentives can be incorporated into these wellness programs, folks, and it could also be included into the disease management and health improvement. How can you improve on your health? Then you will get some rewards as a result of that. So incentives can include merchandise, gift cards, debit cards, premium discounts, and health savings accounts contributions, co-payment reductions, and deductible reductions, co-insurance deductions, and lower employee contributions. So there are so many options, folks. These are the incentives. I want to repeat this again. Incentives can include merchandise, gift cards, debit cards, premium discounts, health savings contributions. You can put money aside. You should be able to incentivize. And also co-payment reductions. If you can be rewarded for that. And deductible reductions for good behavior. These are the rewards. And co-insurance reductions. And lower employee contributions. It can also could lower your premiums ultimately. So personal incentives and rewards can lower the cost of insurance by 20%, folks. 20% or even more. ERISA, which is for the larger employer group, ERISA allows individual incentives based on health status of self-funded groups. Federal Department of Labor allows incentives up to 20 to 30% of premiums for health status and unlimited incentives for participation rewards. See, ERISA law is only for the larger employer groups. So they get all this incentive. What I'm suggesting is you should have the access when your small employer groups can be grouped together, they can get the same benefits of the ERISA self-funded group plans like a federal government does. So they should be able to participate. And they can lower their premiums, folks, by 20 to 30% by participating. These are obviously a group pool. When you smaller employee groups can be grouped into one large group, they will have the same benefits as the federal employee larger groups. So we should encourage smaller employee groups to form a large group pool. So larger employer groups in this country, we have about 120 million larger employer groups, folks. They're covered under the ERISA law. We can give the same access to the smaller employer groups by bringing them and forming them a pool. So Obamacare single risk pool mandate and existing state laws for individual health policies, they discourage implementation of these effective cost-saving programs. See, Obamacare is basically subsidizes, but there are no incentives and rewards. It's all premium based. There are no personal care accounts, there are no health savings accounts, there are no incentives and rewards in the Obamacare. That's what we have been trying to encourage. So consumers can be given an option to be in the driver's seat and they can lower their premiums by participating and pooling together like any other larger group, folks. This is what I've been talking about. These are the health insurance financing options. There are so many options. We don't have to just pay for the premium. We can lower the premium by incorporating incentives and rewards. The Obamacare doesn't do that. So we need to focus on setting up account-based plans, so-called health savings accounts, health reimbursement accounts. Everybody should have health savings account-based plans. All Americans should have that. That gives an added value that also gives you savings. You can lower your premiums, folks. I hope I clarified. If you do like this channel, subscribe, share, and hit that notification bell, folks. Thank you again for joining Personalized Healthcare, so-called health insurance personalized. This is Consumers Doctor on the behalf of Foremost Organization. Goodbye and salute.